So another question. So there are at least one product I'm aware of, but probably multiple versions of it, where there's like fillers that are available now on the market to address girth and whatnot. I'm wondering, is this, when you have like Peyronie's disease and you have curvature, is there like, do men ever request like wanting to fill in? Because sometimes that curvature comes with like indentation. Do men ever request to like correct it with a filler? And is that indicated at all with Peyronie's disease?
So I would just stress that fillers are purely for cosmetic girth enhancement and are meant for guys that do not have like a medical condition of their. Okay. When it comes to Peyronie's disease, which, like I said, causes issues with curvature, length, and girth, there are a number of treatment options that are actually like, medical treatments for Peyronie's disease that can be used. And we can tailor that approach depending on what the goals of the patient are. So if they're primarily bothered by curvature, we have things like traction devices, injections, and surgeries that can seek to correct that curvature. If their main complaint is a loss of girth, whether it's just an indentation or maybe an hourglass shape, we have some treatments for that as well. There is a surgical procedure that we sometimes use for men that have indentation or hourglass called extratunical grafting, which is essentially laying some material underneath the skin to fill in that defect to restore the caliber. Some men, if they have a bad hourglass, will actually have buckling or instability of the during attempted penetration if they're trying to penetrate. And for that, we have different approaches where we'll actually go in and sometimes cut the scar tissue and release it and then sew in a patch called a graft. Sometimes we use implants in patients who have borderline or poor who have Peyronie. So there's a lot of nuance to the different treatment options, but the injectable girth enhancing treatments are not really considered kind of like a standard treatment for Peyronie's. I know some people use it. I just don't think it's really an effective solution for those guys.
Okay, yeah, thank you for that, because it's a newer product from my understanding. It's like a newer option available. You're saying it's purely cosmetic, and there would be other considerations long before that would be done. Now, is it a type of treatment that, let's say, I'll throw out just an idea here for a moment. A person has, let's say, a Peyronie's disease by diagnosis, but it's not progressing, and like it's really like in a wait and see, and they're really just distressed about the appearance side of things. Would they be a candidate, assuming that this is a safe treatment, which I am not, I'm not speaking to that at all, but assuming that it's a safe treatment and the patient wants to go ahead with it, is there a reason that they could not use something like a filler?
Um, I think that the techniques for administering fillers are designed for guys that do not have like a substantial deformity due to Peyronie's. So in general, for patients who have Peyronie's that they're bothered by, let's say, curvature, I would generally recommend addressing that and correcting that prior to considering any sort of, girth enhancing treatment. So it's not that it would necessarily lead to some major harm, but I think the cosmetic appearance, if you had a severe Peyronie's, shape change and then underwent cosmetic fillers, I don't think it would necessarily be what they were looking for. So in general, we would want to address any underlying Peyronie's changes that have happened. And then if they continue to have major concerns about, let's say, girth loss of the entire shaft, and they've been well counseled and, they're just really trying to get closer to how they used to be, then that would be one consideration.